Hi everybody, I'm Dr. Dana Coberly with Coberly Plastic Surgery, and I want to talk to you about something that you may have heard a lot about. Ozempic and other medications are being used very successfully to help patients lose weight. However, it can cause some changes in the body that don't look as appealing, especially in the face. Your body looks much better, but your face, you have extra skin. It can cause hollowing and it can make you look older than you really are. So we like to use 40 as an average cutoff. If you're younger than 40 and you lose weight, your face tends to look better. But if you're over 40 and you lose weight, your face can look worse. It can make you look older. It can cause excess skin to sag. So just filling the face up with fillers doesn't necessarily take care of the problem, because you also have extra skin and you don't have enough elasticity left to tighten it back up. That's where the age difference comes in. So we have things that can be used to help tighten the skin. If you have enough collagen, we can use Morpheus to help sort of shrink wrap the skin to help tighten it up. And that can be used with fillers. Also, fat injections can be used all over the face to help give you that volume back. You should wait until you've reached your stable weight, because you don't want to take fat, inject it, and then have all those fat cells shrink and then lose what you tried to rejuvenate. The other thing that you can do is use threads. We use mint threads. They're PDO, they're temporary, they are absorbable, but you can get a good 6 months of lifting to help redrape the skin, and those threads do encourage your face to create more collagen underneath the skin to give you more volume. So that's something we can do to help with Ozempic face rejuvenation. Thanks everybody.